What can you do if you're suffering with heel pain and you've already tried to stretch your plantar fascia and you've iced your plantar fascia and you've rolled your plantar fascia and you've stretched your calves and you've done eccentric exercises for your calves, but you're still struggling with heel pain? So all of those things are really, really good, but we find that some people, even after they've done all those things, are still struggling with heel pain. And it is that plantar fascia type of heel pain where you get that pain first thing in the morning. It gets better over time. If you do a lot of activity, it will flare up again. And you're looking for something that can be done because all the other things aren't enough on their own. This is the next level. This is the highest step. This is what I do with my patients in the clinic, and I'm going to do on a patient right now to show you how you can do it. Now, I'll admit it's a little bit tough to do at home. I'll try to do my best to explain it, but at least it gives you an idea of something that you can try right now to see if that helps. If you go to see a manual physical therapist, often they will do this for you because it's a little hard to do it on yourself, but it's really, really effective if you've already tried all those other things. Now, I have other videos that I'll link here that will describe those other forms of treatment. So if you haven't tried those, you might want to start there. This is a little bit aggressive and a little bit challenging, again, to do on your own. But if you're looking for that step to get rid of your heel pain specifically, and you've already tried all those other things, this is the technique for you. So when I'm doing it, I like to have gloves on, and the reason is because it helps me be able to get more of a grip on that heel pad. Now the heel pad is this fatty pad that's here on your heel, and we all have them, but sometimes they can get a little adhered down, and that can be due to your calves being tight, it can be due to your plantar fascia being tight, but it just causes this fascial tightening around here, and sometimes you just need to loosen things up a little bit. Now, it's not the easiest thing to kind of grab a hold of because, you know, there's not a good leverage point like bones. It's easier to kind of get a hold of, or even muscles. You can get into the muscle belly, and that's not what we're trying to do here. So what you're trying to do is kind of make a C shape around your heel, and then you're going to kind of squeeze it just a little bit together, and then you're going to rotate it clockwise and counterclockwise. So it doesn't move a lot. It's like clockwise and counterclockwise. But it helps to stretch out the fascial attachments that attach that heel pad down and can make it really compressed. This is an area that doesn't get great blood flow, right? It's really far away from the heart. Obviously, the heel pad is a fat pad, so it doesn't have a ton of blood flow on its own. But just doing a little bit of stretching can be really, really helpful to kind of relieve it a little bit. The other thing you can do is rub along the edge of the heel pad. So if the heel pad's here, kind of rubbing along the edge here and trying to release any fascial adhesions that are found in the heel pad. Now, if you haven't heard me talk about fascia before, fascia is the substance that if you have a raw steak and you're trying to pull the fat off of the meat, there's that white fibrous stuff in between. That's fascia. So it's a little bit difficult because it's almost like we're trying to pull the fat off the steak. I mean, really, a fat pad on the heel is what we're trying to pull off the muscle. So yeah, it's kind of like trying to pull that fat off the steak, and it's a very fibrous layer. Now, obviously, we're not going to pull it all the way off, but we're just trying to put a stretch to it. It shouldn't be necessarily painful. Is it painful?
No.
Not painful. So it shouldn't be painful, but it definitely should feel like you're getting some stretching going on in there. Now, if this reproduces any sharp pain for you, you get any sharp shooting pain, especially that goes up your leg or down into your foot, then I would recommend that you stop, because it's not supposed to do that, and you may be aggravating a nerve, and we all know that nerves don't like to be aggravated, and when they are, they get more inflamed, and that's never a good thing that happens. So just some gentle massage along the outer edge of that heel pad can be really, really helpful to get it loosened up. And again, doing that C shape and turning it clockwise and counterclockwise, realizing that there's not a lot of movement in these tissues, so when they get adhered down, they can lose all of their movement pretty quickly. I recommend spending about 2 to 3 minutes on this. Get up, walk around, see if your symptoms seem to be decreased or if things feel a little bit better. This patient here is actually going to go for a run after this, so we're actually going to see the results of that later on and see how things feel after the run, if it feels like it loosens up better and there's less symptoms after the run. So I hope this is helpful. If you have questions of if you have a plantar fasciitis or if you have more of Achilles tendonitis, then I recommend that you check out these videos here. Have a great day, everyone. Bye.